Okay, well, welcome all, and thank you for joining us today for our grant opportunities overview. I'm Chloe Wiley, the Initiatives Manager here at the Blue Cross and Blue Shield of Louisiana Foundation, and I'll be spending time with you today to go over what we fund and why, our various grant programs, and how to apply. A few logistics before we get started. This session will be recorded and posted to our website for reference. This is anticipated to be a rather large group, so right now we have everyone on mute and we'll be taking questions throughout via the chat feature, in addition to saving some time at the end. You should also feel free to reach out to us directly if you have additional questions or if you'd like to talk through a grant initiative idea. My email is listed on the screen, as well as our other teammates at the foundation, and my email is also in the chat. Okay, so we're going to start with our why, our foundation's mission. We are separate from the company. We're a separate 501c3, and we are dedicated to promoting the wellness and well-being of Louisianians by supporting projects and programs for health or community well-being related items, right? So our rationale for doing so is to ultimately move our state past our previous record of 47th in America's health rankings, and then advancing eventually past the national average in America's health rankings. Therefore, all of our grantees' measurable impacts should really address how they will help our state make movement on those key health ranking categories. So at the foundation, everything we do and fund needs to be in alignment with our mission and those long-term goals. So our funding focus areas are aimed at improving the health of Louisiana communities and improving health outcomes for Louisiana's children. More specifically, in 2022, here are some potential areas of interest for our grant-making programs. Now, this list is neither exclusive or exhaustive, but it may provide you with a little bit more guidance on what kinds of projects are of a particular interest and priority to us right now. So first, in the bucket of community health, we're looking for community health level improvement plans around healthcare workforce, addressing social determinants of health, and maternal and infant health outcomes. Early childhood outcomes, so improving outcomes for Louisiana's youngest children that are high needs, low income, and around maternal health and birth outcomes. Healthcare, workforce, and human capital, efforts to address gaps and shortages of healthcare roles, critical healthcare roles like doctors, nurses, mental health providers, etc. And while we are a statewide funder, we do have a particular geographic focus for this year in the Acadiana and Southwest regions of our state. Also, disaster relief. So we're going to continue to support families, neighborhoods, and communities that are impacted by crisis and disasters. So these are our 2022 funding priorities. Okay, and as you have questions, feel free to jot them in the chat box. So I wanted to take a second and just go over our general grant review process. For all interested parties, it's highly advised that groups connect with us at the foundation before applying. We're happy to have a conversation to talk through any ideas, give you feedback, and also to make sure that you're reading each of the grant program RFPs, which are posted on our website. So the first step is to submit a letter of intent via our new grant management system, Smart Simple, at one of our quarterly deadlines. So 3/1, 6/1, 9/1, or the 12/1 deadline. And I'll talk about the LOI in just a second, but after the initial review of the LOI and questions from staff or reviewers, we invite the most promising applications to submit a full application. And those are due roughly 2 weeks after notification. Staff and reviewers then ask questions, review, gather additional details or information, and our most promising applicants are presented to our foundation board for consideration. So the letter of intent submission is the first step in our review process, and the next deadline is March 1st. And so really this is just a short submission, which includes your primary contact and whoever that person is that you have listed. That's the person that we will be reaching out to throughout the grant cycle. So make sure that's the person who will be dealing with all the grant follow-ups, et cetera. So the title of the proposal, your proposal summary, which is aligned to the RFP, the amount requested, a brief summary of how you will use those funds requested. You'll have to identify your geographical area served. If it's statewide, if it's more than one parish, you want to select statewide. And then need. So talking through your need in terms of the health related issue that you're addressing. And any partners that you're working with, and you will also have to submit your board of directors. So it's a fairly quick overview just to give us an idea of what your proposal is seeking to change and the amount requested. In terms of review criteria, what we look for in all of our grant applications is strong leadership. If the group or the organization is well led, the project will be well led. The plan is based on proven best practices. It targets important and measurable outcomes that are rooted in data, and there's a likelihood of being sustainable and or replicable. So the first grant program that we want to talk through today is our New Horizons grant. So the New Horizons grants the purpose is to support innovative approaches that either solve or more effectively address an issue related to health or well-being. So these are really designed to be proof of concept ideas, pilot programs, trying out new innovative ways to address an issue. These are up to $25,000 over 12 months. It's one payment and no matching funds are required. So here are the questions that you need to have the answer as yes to if you're considering applying for a New Horizon grant. First, does it foster innovation? Will we learn something new? And yes to at least one of the following questions. So is this initiative attempting to answer a question that hasn't been answered by conducting new research? Is it attempting to solve a problem by creating a tool or a plan that doesn't already exist? So again, creating and or piloting a service that doesn't currently exist, conducting research that hasn't been conducted to date, or taking an existing resource or service that isn't currently effective and implementing it in a new way or field. And as an example, this is a New Horizons grant that we have funded previously, the Painted Playgrounds Initiative by LSU Pennington. It was a $10,000 grant and it helped children increase their physical activity by about 15 minutes a day. It created, as a result of the initiative, they created a free online toolkit that was developed as part of the grant to really provide step-by-step instructions for anybody that wanted to replicate that program. And there was also a scientific publication of these results. A few other examples, we funded a program with St. Vincent de Paul to do a free community dental clinic in order to reduce emergency room visits. We funded 100 Black men to design a curriculum to help students cope with mental health and racial challenges. So again, if you have an idea and you're not quite sure, the best bet is just to go ahead and reach out to us. We'd be happy to chat through any ideas you have for a New Horizon grant. And again, if you have questions, feel free to plug them into the chat as we go along. I'll also save time at the end. The next grant program is our special project grants. So these grants support organizations that are looking to increase their community impact. They may focus on a number of issues that are focused on Louisiana's health or well-being. They're up to $100,000 over 1 year for one payment. And really, these are, again, for organizations that are looking to expand their impact. So it can be to complete an existing project or program that we previously funded through a New Horizon grant or other initiative, or for the organization to really strategically expand their current efforts or implement new efforts that are really rooted on clear evidence and need around solid data. An example of a special project that we funded in the past is with James Samaritan for their Open Table initiative. So it was a $100,000 special projects grant to scale up a program that connected young people aging out of foster care with caring adult mentors who could really help them navigate the transition. Through this special project grant, they were able to initiate 30 open tables, and they have been recognized by the Open Table movement as recruiting and starting more new tables over the past couple of years than any organization in the country. So really proud of this initiative. Other examples of special project grants, we've worked with Line for Line to help them expand their barbershop literacy initiative, serving African-American boys, and the Baton Rouge Early Childhood Education Collaborative for their Home Start Early Childhood Home Visiting Program that's geared towards supporting residents of public housing. So our largest grant category is our collective impact grants. So these are multi-year grants of $250,000 to $1 million, and they're really designed to help communities solve pressing health and community issues in a way that no one organization would be able to do on their own. So in this, it supports a coalition of partners. So multiple organizations coming together to really solve a complex problem that could lead to lasting change in the community. This grant program, there is a matching fund requirement, and there is a requirement of multiple partners working towards the same initiative. A couple best practices here. We want to make sure that groups have, sorry about that. Trying to juggle the chat and the slides, sorry about that. So a couple best practices in terms of collective impact grants. We really want organizations to come to the table before they submit their initiative, rooted in data. So having data to define the complex issue that you're working to solve, really rooted in those community health rankings. There's a clear identification of partners. So these groups have met multiple times to talk about the initiative. They've created a shared vision and approach, and they have a plan to create consistent activities and shared measurements. So all of those are in place before initiatives come to the table for a collective impact submission. And one example of one of our successful collective impact grant projects is the Northeast Louisiana Nurse Initiative. So this was a 3-year grant, a $300,000 investment to address the nursing shortage in Northeast Louisiana. Here they brought together healthcare providers, higher ed institutions. They worked with the local workforce development board, and they all collaborated together to create a solution of sharing adjunct faculty and trainers on flexible schedules or just non-traditional shifts. So clear collaboration across the board, really zoomed in on the fact that they needed more adjunct faculty to get more nursing students in the door. And as a result, they're on track to train more than 180 nurses over 3 years. And again, as you have questions, feel free to drop them into the chat. Our next program is our Angels of Change grant. And so this comes from our Angel Award. So each year our foundation awards $25,000 grants to support 8 volunteers across the state that are really improving the lives of Louisiana's children. And so we encourage you all on this call, if you know somebody doing great work on behalf of kids, please submit a nomination for an Angel Award. Nominations are due this year on April 8th, and you can find more details on our website. So our Angels of Change grant is really geared towards coalitions of previous Angel honorees and their partners. These are $250,000 grants made to coalitions of previous Angel honorees and their partners that are coming together to address a systemic health and quality of life issue impacting our children. Same deadlines, and it can really be a launching board to a larger collective impact grant. Couple of examples here. One, we funded the Baton Rouge Workforce and Empowerment Coalition, which came together with multiple angels. You can see them all listed there on the screen. And they really wanted to increase youth workforce development opportunities and limit the social determinants of health for 1,000 or more opportunity youth in the Baton Rouge area. They built a broad and really deep collaborative that is serving under-resourced young people and cross-sharing resources so that they can better provide supports for them. Another example is David Raines Community Health Centers, their Wellness on Wheels mobile medical unit for children in Shreveport in Northwest Louisiana. So Northwest Louisiana did not have a pediatric mobile medical clinic. And so David Raines and their sister Sharon, who's a previous Angel winner, came together and said, we want to expand quality healthcare access across disadvantaged youth and through a mobile medical clinic. So they wanted to address the fact that many children don't have access to healthcare and they lack vital vaccinations. So these are two examples of our Angels of Change grant recipients. And the key traits that kind of made these very successful applications were that there was a clear evidence of collaboration among two or more angels. They were solving a systemic issue or expanding current efforts together. And again, these two initiatives could potentially lead to a larger collective impact initiative. And if you are a previous Angel Award winner, or you'd like to know who they are in your area, or maybe by your specific work type, there is a database on our website that you can access and sort by year, by work type, and by region. So if you're interested in finding potential angels to work with, it's a great resource to utilize. And our last grant program that I'm going to chat with you about today is our Community Crisis and Disaster Response Program. And this was designed to help partners address immediate community needs after a disaster or crisis. So these funds can be used for general operating support. It can be used to fill in gaps, some fundraising, et cetera. So they were created in the spirit of after COVID-19 and the impacts of hurricanes and other natural disasters. So these are reviewed on a rolling basis. They're up to $50,000. It's a one payment. And again, just really looking for groups that are trying to help with the relief and recovery efforts of a crisis or a disaster. So in terms of what we additionally like to support, we spoke a little bit about our 2022 funding priorities. We'd also like to see community level opioid efforts. So it's a really big area of need. We don't get many applications in this space. As mentioned before, efforts to close gaps in healthcare human capital. If you're interested, last spring or last fall, recently, we did a healthcare human capital series that talked about some successful projects in that space. So check it out. It's on our website. Also efforts to improve outcomes for high-needs kids and families. And then, as mentioned before, community level health plans with a particular emphasis on Southwest Louisiana and Acadiana. So briefly, I wanted to touch base and let me check the chat and see if any questions came in that we can address. Let's see, I don't see any questions, but again, if you have them, feel free to drop them in the chat. Okay, so let's talk through how to apply. This is kind of hard to do. So first, we have a new grant management system, and so you can find it on our website if you click the link, but the address is also listed at the top of the screen. So you're going to log in. So if you've ever used our grant management system in the past, then you probably are in the system. So put in your email, and if you don't know your password, you can click forgot password, and it'll lead you to reset if you're in the system. If you're not in the system or you've never applied before, then you're going to click the new to the system button and register. And so when you do that, it will lead you to an organization search. You need to have your EIN handy. When you put your EIN number in, the organizations will come up. You'll find your organization and click it. And then make sure that all of your information is correct. And that will complete your registration. That's if you are a new user and haven't logged into either this system or our previous system. So once you log into Smart Simple, your screen will look like this. It'll be a dashboard. And to find out or to apply for any of the grant programs that were previously mentioned, you click on the Funding Opportunities button, which is going to lead you to a list of all of our funding opportunities, from community crisis grants, corporate sponsorships, any grant program that we listed are all there, including the RFP. So again, please make sure it's a great idea to look at that RFP because it gives you some more insights and details on what we're really looking for each of those programs. So after you've read the RFP, you can click on the Apply Now button, and it's going to lead you to an eligibility quiz. It's just a quick eligibility quiz. So once you submit that, it's going to lead you to a letter of intent. And again, the letter of intent is really just a quick summary, the amount requested, et cetera. So it's a high level overview of the initiative that you're trying to do. So once you complete that letter of intent submission via Smart Simple, it'll come to us for the review process, and you'll hear back from us on whether or not your organization is invited to submit a full application. So with that, that's kind of the high level overview of everything that we have to offer, what our priorities are this year, and how to apply. So I'm going to pause now and see if any additional questions came in that we can help out with now. If you have any, please put them in the chat. Okay. So can an organization apply for multiple grants? The answer is yes. However, you may want to consider really thinking through what's the best fit for each particular grant cycle. But yes, you can apply for multiple grants. If we are an existing grantee, should we add our new staff? That's a great question. The simple answer is you want to make sure that the primary contact is up to date. So whoever is the primary contact for that grant project, that's who needs to be updated in that section. So that's really the key thing, but it's also a good idea to have your new staff go ahead and register under Smart Simple so that they have a login in case they want to pursue funding opportunities, et cetera. Can I please send the link? Yes, I will put the link in the chat momentarily, and we'll also follow up with an email after this. So one question is that this is a group that's never received a Blue Cross grant before. Can we apply for the special projects grant? Yes, you can if it is expanding your community impact or an extension of your work that you're looking. I think the key thing that we really need to see with all of our special project grants is if there is a sustainability plan. So after our funds are gone, how will this expansion continue? And so there really needs to be a thoughtful and strategic vision for your sustainability plan for any of the special project grant requests. Do we have page limits for, these are great questions, keep them coming. Do you have page limits for LOI and full proposal or have formats? So yes, it is all done electronically in the system. And so when you log into Smart Simple, all the questions are in there and you're going to enter it straight into that document. So The format is already pre-populated, so it's not an actual letter of intent, it's a letter of intent submission via the online platform. So one question is, you said it's best to connect before the LOI. Is there a certain person on the team to reach out to? Yes, that would be me. So you can email myself, Chloe Wiley. I'll put my email at the chat, and it's also on our last screen. Let me go ahead and actually put that screen up. So our emails are all listed there. You can email myself, you can email the foundation, or Tanya Foyle, who's our foundation initiatives coordinator. You can email us and ask for a time to set up a call or a Teams meeting to talk through any of your ideas. Let's see. In terms of sharing requirements, if you look on our website, and I kind of outlined them earlier in terms of the criteria that we're looking for, you can actually find an overview of our scoring rubric on our website if you look under frequently asked questions. And so it just gives you a high-level overview of the categories that each grant application is rated on. And those are really centered around the need, that there's clear measurable outcomes, there's a sustainability plan, and that the leadership team in place is well led and organized. Thanks, Michael. Michael put in, our president, Michael Tipton, he put in the chat box a link to all of our grant programs that you can find, and also the eligibility requirements that we just chatted through. Clarification question: can an organization apply for a grant and an employee of our staff be nominated for the Angel Award? Yes. So we encourage everybody to put in an Angel Award nomination for somebody that you think is doing great work on behalf of kids. It can open the door to potentially collaborating with other angels for an Angel of Change grant. But yes, you can apply for any of our grant programs at any of our quarterly deadlines. Will I be able to get a copy? Yes, it is being recorded, and we are going to post it on our website under our grant programs page so that you have access to this information. But if you have questions that do come up, please email us. We'll be happy to shoot you a quick response. Great question. Can the same individual win an Angel Award more than once? I think great question. I don't think so. We want to try to spread awareness of a lot of great organizations doing great work on behalf of kids across the state. So it's unlikely that the same person would win more than once. If awarded a grant, when will funds be sent? So typically from start to finish, so I'm going to use this upcoming grant cycle. So March 1st is the letter of intent submission. And we go through our board meeting is quarterly also. So we would present final applications for consideration at the May board meeting. So funds would usually be available starting mid-May. So it's around a 2.5 month process. But once an application is approved, we turn around the initial funds rather quickly. Are there requirements for individuals nominating a person for the Angel Award? Nope. And again, Michael, I don't know if someone can put a link to the Angel Award nomination so that folks can take a look at that. Do we have grants for small businesses? So we do not grant, one of our eligibility requirements is that an organization is required to be a 501c3. So we are strictly funding 501c3 nonprofits. There are a few exceptions under disaster response, and those requirements are listed on the eligibility screening as well. Any other questions? These are great. Well, again, all of our email addresses are there. If you haven't already, please sign up for our mailing list. It's listed there on the screen. Reach out if you want to talk through or workshop an idea. We're happy to help. We appreciate all of you joining in to learn more about what we fund and how we do it. And thank you on behalf of our entire team for just all the great work that you do to help make our state even better. So thank you, everybody. Appreciate it. Again, I'm going to hang out. I'm going to stop recording and hang out if folks have additional questions. But again, feel free to reach out, and this will be posted on our website. Thanks all. Have a great rest of your day.